Matthew Holt, and I've got a quick interview with Sarah Hines. Sarah is the CEO of PharmaSecure. This is a company we ran into at Health 2.0 last year, and they're doing some pretty interesting stuff. So Sarah, in a nutshell, what does PharmaSecure do?
PharmaSecure is doing drug authentication in emerging markets via text messages.
That's a good explanation. So this is to do with the problem that in India or Africa or somewhere there are a lot of counterfeit drugs, and you figured out a way that people, consumers themselves, can easily figure out whether or not this drug is counterfeit by using your service. So let's take a quick look. How does it work?
So somebody goes to the drugstore, they purchase drugs, they look at the code that's printed on each package.
So there's a little code on that package there. Probably can't tell on the screen, but anyway.
Then they use their phone and they send a message. And we will send to...
So we're going to test a message here.
41411. The message is drug check, and the code is JCD4.
And they take that code straight off the blister pack?
Correct, and it's unique to each blister pack.
Okay, so before you send that, let me take a quick look. So they just typed in that code. Hopefully it will focus. Okay, go ahead and do the send.
Now I send it.
And how long? And that's now heading off to a database that you have in here, or is it India? Where are you guys based?
Our database is held in the U.S.
Right, and is your first market in India, or
our first market is India because emerging markets are the markets that are most hit by counterfeit drugs.
So give me a extent of the scale of the problem. Is it like 10% of drugs, 50% of drugs?
If we're looking at the most commonly counterfeited drugs, it's between 10 and 30% of those. Those would be antibiotics, antihistamines, actually life-saving drugs in many cases.
Right. So we're back with the response.
Yeah. So here's the response.
So now a text message response. I don't know if you can see that on the camera. Probably not. But what does it say? Just read it to me.
It says code JYCD48H79. The code that I entered is valid and expires on 2020-05-26. Service provided by PharmaSecure.
Great. So now assume that works. It's a self-service thing. Works on any SMS messaging system. How are you going to roll this out? Presumably the drug companies are interested in making sure that their stuff is and the consumers are interested, but I assume that somewhere in the middle between the wholesalers and the retailers there's a lot of more dodgy stuff going on, and probably they're making a lot of money off these counterfeit drugs. So do you work with the manufacturers, or how are you getting this done?
We work with the manufacturers. We code each product at the point of manufacturing and work with only certified manufacturers so that we can be ensured that the product is authentic. There are very opaque distribution networks, so this puts the manufacturer in touch with their patient, which doesn't exist by and large in emerging markets today.
All right. And then obviously that's a big area. We do see there is a problem with counterfeiting drugs in Europe and actually also in the US. Tell me a bit about, and this is a novel way of getting at that issue here too. Do you have plans for that as well, or are you at the stage where you're just focusing on the emerging markets right now?
Right now we're focused on emerging markets. There are long-term plans for developed markets. We could do an online offering or something more suitable for these markets.
All right, and give us a quick thumbnail sketch about the background of the company, where it came from, how long you've been around, what you're looking for.
We incorporated in the U.S. in 2007. My business partners Nathan and Taylor were students at that point. They did a year of research in India and Africa to try to figure out where the best market for PharmaSecure was. They decided to focus on India, and I joined up about a year later to head up operations in India. And so we've been focused really hard on the manufacturing industry there, and also sensitizing government to what we're doing.
That's great. And where are you in the sort of technology development versus the business development? So technology basically, this was in test mode obviously, but are you up and running in live situations or not yet?
By the time this airs, we may be up and running. Towards the end of this month, we're rolling out a proof of concept in India, and then we're looking to roll out a commercial pilot probably spring of 2010.
And business-wise, are you self-funded? Are you looking for funding at the moment, or what's
We just closed a Series A, and that provides runway for about 18 months. So towards the end of 2010, we'll be opening up a Series B.
Well, hopefully by then you'll be massively profitable and not have to worry about this.
Right. We hope so.
Great. I've been talking with Sarah Hines. She's the CEO of PharmaSecure, which is a new company doing some really interesting stuff in the battle against counterfeit drugs. Thank you, Sarah.
Thank you, Matthew.